Pheochromocytoma is one of the most important topic. Usually they ask you on the basis of difference between pheochromocytoma and carcinoid tumors. So first we will see pheochromocytoma. So what you need to remember is it is found in the adrenal medulla in adults. So suppose they can also give you a picture and they can give you something like this and they will ask you diagnosis, what is this? So most likely it could be pheochromocytoma. They are derived from the chromaffin cells. Then also they are associated with NF1, which is neurofibromatosis 1, VHL, von Hippel-Lindau syndrome, Rett gene, and MEN2A and MEN2B. Also they follow rule of tens, which is 10% malignant, 10% they are bilateral, 10% they could be extra-adrenal, and extra-adrenal where they can be found, it is bladder wall or organ of Zuckerkandl. Then 10% they calcify and 10% they are found in kids. What will be the clinical feature? There will be the clinical feature will be there would be episodic hypertension, and they could be coming and going. That is why it will relapse and remit. They come in spells. Then how will you diagnose it? So suppose they can give you two question. Either they will ask you screening or they will ask you definitive investigation. So if they ask you screening, then a urinary metanephrine or urinary vanillic malic acid will be the answer. And if they ask you definitive, then the answer will be plasma metanephrines. What will be the treatment? So remember, pheochromocytoma is 16 letters, so the treatment will be the same 16 letter, which is phenoxybenzamine. Then after giving phenoxybenzamine, you should also give beta blocker like propranolol, atenolol, or anything. Betalol. For beta blockers, you can remember it like betalol. Betalol is propranolol. So to avoid a hypertensive crisis. So the another is carcinoid syndrome. In carcinoid syndrome, you just need to remember a few things. First, it has high level of serotonin, whereas in pheochromocytoma, we had high levels of epinephrine. Second, what is the clinical feature? It is diarrhea, cutaneous flushing, and asthma. Then how will you diagnose? You will diagnose by urinary 5-HIAA, which is 5-hydroxy indole acetic acid. And what are the markers? The markers are chromogranin A and synaptophysin. And what will be the treatment? Treatment will be either you can surgically remove it or you can give octreotide. In pheochromocytoma, we have followed the rule of 10, and in carcinoid tumor, we will follow rule of 1/3. 1/3 they will metastasize, 1/3 present with secondary malignancy, and 1/3 they are multiple. Also, they are the most common malignancy in the small intestine. So they can also give you hint in a question like that. It is the most common malignancy in small intestine, or they can give you a clinical scenario where they can tell you that there is some kind of pathology in small intestine, and they can give you clinical features like this, and you have to diagnose. Then the answer will be carcinoid syndrome. Thank you, and the notes will be in my Telegram group.